Health Chat is sponsored by Valley Benefit Solutions.
My wife and I love talking to people about their Medicare plans, basically because we get to see the look on their faces after we find a plan that's right for them, the look on their faces of just relief, right?
Exactly, relief.
Happy about all the money that we've saved them, happy that they get all these extra benefits they didn't know they were entitled to. It's really nice to get to meet people and to learn about them, their dogs, their life, and we meet a lot of interesting people along the way. And it's just been a wonderful experience, and I just love to continue that as we move forward, especially during this.
It's a lot of fun. It really is a lot of fun to meet the new people, and I do a lot of the customer service because I enjoy chatting with everybody and having a good time and learning about their lives. Sometimes I talk too much. I apologize, but it is a great time. We have fun. I am a retired school teacher. I taught for 27 years, and my subject was math. So let me tell you, one of the most confusing subjects there is. Perfect. Here comes Medicare. So I can help teach the ins and outs of Medicare with my background as a teacher. It can be very confusing. And when Brian's talking about Medicare, sometimes I read the body language like I would on my students, like the head tilt or just that look of confusion that would come over their face. So then we gotta stop. They got questions, we gotta get this figured out. And I love to simplify because I simplified as a teacher because kids need to go at their pace and people that are learning Medicare need to go at their pace. And I'm visual, so I have a whiteboard in our office that I love using, and I love using different colored markers to get my point across. I just think visuals help people remember things more easily. So I think doing Medicare with my teaching background has really turned out to be a good thing for us and for you.
Well, we like to educate people about their plan, and the more informed you are, the better decision they're going to make. This year, more than ever, is the time to really compare plans. The biggest change in Medicare since 2006 in regards to prescription drugs. For those of you who are on like high dollar medications, if you've hit the donut hole or the coverage gap, this is a year to compare because you're going to be in for actually a pleasant surprise of how the plans are going to change. Take a look at your annual notice of change, then call me and we'll go over and I'll explain those changes and find a plan that's going to be right for you. Every year we go through testing.
Yes, we do, just like kids.
Every insurance company also requires us to take some quizzes, testing to learn about their plans every year and all the changes in their plans so that we're on top of things for you. We go to conferences, and then every 2 years we need continuing education credits just to keep up with all the Medicare changes as well. And that helps me explain things to you.
Well, I agree, and it helps us learn the plans better to bring that to our meetings, and so the clients can see what's out there for the upcoming year. What it cost? It's free of charge, but what we do say is you need to pay attention, and I used to do that all the time in my class. Please pay attention. Pay attention to what we're putting in front of you so you can make an educated decision based on your needs and what plan will work best for you.
It's important to find an agent who is local instead of calling an 800 number to a call center on TV. More importantly, because you get to sit down with them, look them in the eye and go over the plans, but also once you're enrolled, to be able to call them and contact them at any time to get your questions answered, you have somebody local to do that. And I think that's the most important thing when you make a decision with your Medicare plan. Please give us a call at 330-979-4234 and you'll actually talk to me. You're not going to talk and get a menu or anything like that. You'll actually talk to me. And that number I give out for people, even after they enroll in a plan, that's the number they call to get any of their questions answered. I always tell people, don't call the plan's customer service, call me instead.